nature sing. Joy to the world, it's Christmas time for every girl and boy. The fields and plains, the hills and dales, repeat the sounding joy, repeat the sounding joy, and let everyone repeat the sounding joy. Joy to the world, joy to the world. Silent night, holy night, all is calm and all is bright. Round yon virgin, mother and child, holy infant, so tender and mild, sleep in heavenly peace, sleep in heavenly peace. Silent night, holy night, all is calm and all is bright. Glory stream from heaven above, heavenly hosts singing Alleluia. Sleep in heavenly peace, sleep in heavenly peace, sleep in heavenly peace.
a winter wonderland. But memories now are all I have. Here with me in a photograph. Oh, Santa Claus, I still believe. Won't you grant a little wish for me? 'Cause all you know I to Wonderland, but memories now are all I have. Here with me in a photograph. Oh, Santa Claus, I still believe. Won't you grant a little wish for me? 'Cause all you know I really need is my baby home for Christmas Eve. Oh, yeah. Is my baby home for Christmas Eve? Is my baby home for Christmas Eve? My baby home for Christmas Eve.
Dr. Jennifer Russell, the province's Chief Medical Officer of Health, the Honorable Dorothy Shephard, Minister of Health, and the Honorable Blaine Higgs, Premier of New Brunswick. Les porte-paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, le Dr. Jennifer Russell, l'Honorable Dorothy Shephard, Ministre de la Santé, et l'Honorable Blaine Higgs, Premier Ministre. Dr. Russell.
Good afternoon, bon après-midi à toutes et à tous. Noël et les temps de fête, c'est toujours sur notre porte de nouveau, soit la deuxième temps de fête et Noël depuis le début de la pandémie mondiale de COVID-19. Je suis certain que personne n'est heureux de la situation dans laquelle nous nous trouvons aujourd'hui, c'est-à-dire que nous tentons toujours de limiter la propagation du virus responsable de la COVID-19. Once again, the holiday season is upon us, and this will be the second holiday season of the COVID-19 global pandemic. And I'm sure that no one is happy to find that we're here today again working towards containing and decreasing the spread of COVID-19. We had all hoped for a better end to this year, but the virus is still with us. It will continue to be with us for some time to come. Therefore, we must all do everything we can to keep ourselves, our families, and communities safe during this holiday season. Le nombre de cas de COVID-19 dans les administrations juste à côté de nous, à Québec, en Maine, à Nouvelle-Écosse, ne cesse d'atteindre des nouveaux records. Le Québec a signalé 4 500 nouveaux cas hier. La Nouvelle-Écosse annonce quotidiennement près de 500 nouveaux cas depuis 5 jours. La région rurale de l'Est de l'État du Maine montre l'un des taux d'infection les plus élevés aux États-Unis. Cette situation ne s'est pas encore produite ici pour le moment. Everywhere around us, COVID-19 infections are reaching record levels. Quebec reported 4,500 new cases yesterday. Nova Scotia has had nearly 500 new cases daily in each of the last 5 days. Rural eastern Maine is reporting one of the highest infection rates in the United States. This has not happened here yet, but it will likely happen, and it's not if, it's when, and it is important that all New Brunswickers are prepared for this. The Omicron variant is far more contagious than the versions of the COVID-19 virus that we have seen thus far in this pandemic. I'm going to show you a slide, and where you see the yellow, that shows our projection based on our current trends in New Brunswick. As you can see from this slide, when Omicron replaces Delta as the dominant strain in this province, as is happening elsewhere, we expect the number of COVID-19 infections will double every 3 days. That is an exponential growth. At that pace, our modeling suggests that we could see up to 250 new cases each day by early January and as many as 400 new cases a day by the end of next month. À ce rythme, nos mécanismes de modélisation laissent entendre que nous pourrions avoir jusqu'à 250 nouveaux cas par jour au début de janvier et jusqu'à 400 nouveaux cas par jour d'ici à la fin du mois prochain. Even if Omicron turned out to be a milder form of the virus, and the jury is still out on that, the sheer volume of cases will result in a larger number of severely ill patients. That will put an even greater strain on our healthcare system. The interim measures introduced last week will help to slow the spread of the virus, at least temporarily, but it won't stop it. No one should expect that we will escape the aggressive spread of this virus that our neighbors are already experiencing. That is why we will have to do more in the days and weeks ahead to buy us the time we need to get even more New Brunswickers vaccinated and boosted. Aujourd'hui, Santé publique annonce qu'il y a 156 nouveaux cas de COVID-19 au Nouveau-Brunswick. Avec 157 rétablissements, il y a présentement 1268 cas actifs dans la province. Le nombre d'hospitalisations demeure relativement stable. À l'heure actuelle, 41 personnes sont hospitalisées en raison de la COVID-19, dont 19 aux soins intensifs. Today, Public Health is reporting 156 new cases of COVID-19 in New Brunswick, with 157 recoveries. There are now 1,268 active cases in the province. Our hospitalization numbers remain fairly stable. 41 patients in hospital with COVID-19, of whom 19 are in ICU at this time. While the virus can infect anyone, it is the unvaccinated who remain at greatest risk of serious illness. The frail elderly are also at risk, as their immune systems may be less able to fight off an infection. Vaccines remain the best protection we have, which is why it is so important that every New Brunswicker gets fully vaccinated as soon as possible. 1 year ago this week, the first New Brunswickers were vaccinated against COVID-19. And since then, we have administered 1,403,970 doses in the province. I want to thank everyone who has worked to deliver these vaccines in regional health authority clinics and participating pharmacies over the past year. Your efforts are making a difference. Une très grande majorité de la population de Nouveau-Brunswick a maintenant reçu 2 doses d'un vaccin et nous agissons rapidement afin de vacciner des enfants de 5 à 11 ans. Les personnes de plus de 50 ans qui ont reçu leur 2e dose en juin ou plus tôt sont admissibles à une dose de rappel et les membres d'autres groupes d'âge y seront admissibles au cours des prochaines semaines. The vast majority of New Brunswickers have now received 2 doses, and we are moving quickly to get children aged 5 to 11 vaccinated. Booster shots are available for those over 50 who had their second shot at least 5 months ago, and we will expand eligibility to other age groups in the coming weeks, with 40-year-olds expected to be eligible in early January. It is important to get vaccinated quickly. If you had a Pfizer vaccine for your first or second dose, you can get a Moderna for your booster. They're both mRNA vaccines, and they work in the exact same way and are equally effective in preventing serious illness. Please take the first vaccine that is offered. We are taking all of these actions to reduce the threat that our healthcare system will be overwhelmed by new COVID-19 cases. The threat is real, and not just because of the potential for surging hospital admissions. Those who work in the healthcare system are particularly vulnerable to this virus, as are their families. I am deeply concerned about the impact of healthcare workers being off the job in the coming weeks, either because they have contracted the virus or are required to isolate because someone around them has become infected. We could see up to 30% of our healthcare workforce off the job in the coming weeks, which will make a bad situation in our hospitals that much worse. With the anticipated growth in new cases, we are taking steps to ensure that we effectively manage cases and protect those who are most vulnerable to this virus. À compter d'aujourd'hui, les personnes chargées de la recherche des contacts ne s'occuperont plus d'aviser les contacts étroits de personnes ayant contracté la COVID-19. Les personnes ayant contracté le virus devront communiquer eux-mêmes avec leurs contacts étroits. Santé publique donnerait des conseils aux personnes infectées sur les renseignements à fournir à leurs contacts étroits au sujet de la marche à suivre pour le dépistage et l'isolement. Beginning today, contact tracers will no longer be notifying close contacts of confirmed COVID-19 cases. This will be the responsibility of those who are infected, and this is what is happening as well in Nova Scotia. Public Health will provide advice to infected persons on what to tell their personal close contacts regarding testing and isolation procedures. Public Health contact tracers will only contact the individual who tested positive or their employer and will provide them with isolation and testing guidance, as well as instructions on how to notify the close contacts using template letters. Public Health will only step in for contact notifications if no other means are available. We will take specific actions to limit the spread of cases in schools. When an infection is confirmed in a K-8 school, the entire school will be considered close contacts, and all students and staff will be required to take daily point-of-care tests. In high schools, this rule will apply to the infected students' classes and those who travel on the same school bus. With these protocols, we aim to continue to provide notice to any infected person in a high-risk setting within 24 to 48 hours. Over the holidays, I would ask you to take some time to think about those who have been working around the clock to keep New Brunswickers safe. Pendant les temps de fête, je vous demande d'avoir une pensée spéciale pour les personnes qui travaillent sans arrêt en vue de protéger la population du Nouveau-Brunswick. Merci beaucoup. Je souhaite un très beau temps de fête à toutes les citoyennes et à tous les citoyens de la province. Thank you very much, and my sincerest best wishes for the holiday season to all New Brunswickers.
Good afternoon. Bonjour. At this time of year, we love to gather and spread the holiday spirit. Unfortunately, with the virus as easily transmissible as COVID-19, it is all too easy to spread more than just joy when we get together. And the holiday season offers the perfect opportunity for that to happen as we gather with family and friends. We saw a spike in cases last year after the holidays, and know there is a good chance we will experience something similar, or even worse, again this year. We want people to enjoy the holiday season, but we must find a balance that helps us keep New Brunswickers safe. Nous voulons que les gens profitent de la période des fêtes, mais il faut trouver un juste milieu pour protéger les Néo-Brunswickois et les Néo-Brunswickois. We know that with the holiday season comes more gathering and socializing, especially with the 21 months we have just experienced. It is vital that we work together, as we have done before, to slow the spread of Omicron and other variants of the virus. We can still experience the joys of the holiday season with our loved ones, but we must do it safely. We all want to have as normal a Christmas as possible, and we want to spend time with friends and family without putting them or ourselves at risk. And there are many ways we can do that, but the best way is to follow public health measures. The majority of New Brunswickers have been doing the right thing all along and want to continue to do the right thing. And I want to sincerely thank each and every one of you for your efforts. Je tiens à remercier sincèrement chacune d'entre vous pour tous vos efforts. While the steps are simple, they aren't always easy, and we're all tired. Unfortunately, COVID doesn't get tired. The importance of getting vaccinated against COVID-19 and getting your booster as soon as you are eligible cannot be understated. The more people who are vaccinated, the less severe our outbreaks will be. As of today, 82.7% of New Brunswickers are fully vaccinated. 89.6% have received their first dose of a COVID-19 vaccine, and 14.8% have received a booster dose. Today, we are expanding eligibility to include immediate household family members 18 and over of those who are working in long-term care facilities, hospitals, and schools. In addition, early childhood centers and daycare staff, and immediate household members 18 and over if the individual is 158 days since their second dose. I encourage everyone who is eligible to make an appointment to get vaccinated, and I encourage parents to get your children age 5 and older vaccinated as soon as possible. Vaccines coupled with public health measures continue to be our best line of defense against COVID-19. We haven't gotten where we are without the support of so many people across this province. I want to thank many New Brunswickers who have spent the last 21 months following public health advice and rising to every challenge that's been thrown our way. I also want to thank our many healthcare workers around the province who have made enormous personal sacrifices to support our healthcare system throughout this pandemic. Over the next few days, I hope New Brunswickers are able to take the time, enjoy the holidays with their loved ones, and that they do so safely. Je prie que les Néo-Brunswickois et les Néo-Brunswickois pourront profiter de fêtes avec leurs proches au cours des prochains jours et qui le feront sans prendre des risques. Thank you. Merci.
Good afternoon. Bonjour. We have all watched with concern as the Omicron variant has spread in neighboring provinces and across the border in Maine. Though we have managed to keep our case numbers stable, we know it is only a matter of time before we see the same kind of exponential spread happening in New Brunswick as is happening across Canada and around the globe. Hier, j'ai discuté de la situation actuelle avec les premiers ministres des autres provinces de l'Atlantique. Les ministres de la Santé et les représentants de la santé publique ont également participé à cette réunion. This morning, Cabinet met to discuss next steps. Based on the recommendation of Public Health, all zones in the province will be moving to Level 2 of New Brunswick's COVID-19 winter plan. The move to Level 2 will go into effect on Monday, December 27th at 11:59 p.m. Le nombre de cas est actuellement plus faible dans les zones du nord de la province. Cependant, le nombre total de cas continue d'augmenter et le risque est élevé dans toutes les régions. We are announcing the move to Level 2 today because we know that this change will have an impact on both people and businesses, and we wanted to give everyone time to prepare. At Level 2, New Brunswickers must limit their household contacts to a maximum of a steady 10 individuals. This will offer some flexibility and will align with what is happening in other jurisdictions while keeping contacts low. Also, at Level 2, patrons are still permitted to dine in at restaurants, but restaurants will operate at 50% capacity and either have barriers or 2 meters of distance between tables. Les entreprises et le commerce de détail sont ouverts à une capacité de 50% avec des mesures de distanciation physique. Lorsque c'est possible, les entreprises devraient encourager les employés et travailler à partir de la maison. Gyms and entertainment centers, as well as salons and spas, are open with proof of full vaccination at 50% capacity and 2 meters of physical distancing. Salons and spas can put in barriers between patrons, and they obviously do not require distancing between the patrons and the service provider. Businesses, organizations, and event spaces will operate at 50% capacity of the venue to a maximum of 150 people. Lors de ces activités, les participants doivent demeurer assis. Ils ne doivent pas rester debout, socialiser ou danser. Le port de masque est aussi obligatoire, sauf pour manger ou boire. L'objectif est de réduire le contact et la capacité du virus de se transmettre d'une personne à l'autre. Faith venues must operate at 50% capacity with no choirs. One soloist is permitted as long as they are a minimum of 4 meters from the congregation. The current measures for sports and recreation will continue. Professional leagues will be operating at Level 2, which means that practices can continue, but games are canceled. For the moment, we will remain at Level 1 with the interim measures in place. Our hope is that people will take steps now in advance of further measures beginning to keep their contacts low and slow the spread of this virus. Si nous avons moins de contacts, nous serons dans une meilleure situation dans les jours à venir. En respectant les mesures en place, vous pouvez avoir une grande influence. Vous aiderez aussi tous les gens de New Brunswick à passer une saison de fêtes en santé et en sécurité. We recognize that government has a role to play when it comes to curbing the spread of COVID-19, but so do individual New Brunswickers. Government can come up with the restrictions and the requirements, but it is up to individuals to do the right thing. Every choice we make and the actions we take impact not only us, but the people that we live with, we work with, and we socialize with. Our loved ones, our neighbors, our communities. An important component in our fight against COVID continues to be testing, as it is through testing that we get a clear picture of what we are up against. Since the beginning of the pandemic, New Brunswick has given out 6.4 million rapid tests through regional health authority, distribution sites, schools, and chambers of commerce across this province. Every student in kindergarten through grade 12 was sent home with testing kits this holiday season. Nous invitons tout le monde à continuer d'utiliser les tests rapides parce qu'ils sont très utiles pour nous aider à détecter les cas, en particulier chez les personnes qui n'ont pas encore des symptômes. In fact, many of the recent positive PCR tests have come as a result of people doing rapid tests, getting a positive result, and booking a PCR test to confirm. Having these tests available helps to give New Brunswickers peace of mind as they gather for the holidays, knowing that they are not passing COVID-19 to loved ones. Getting rapid test kits in the hands of New Brunswickers doesn't just happen. It has taken a lot of organization and effort on the part of many people. Thank you for your hard work. You are making a difference for individual New Brunswickers and for our province. En cette période de fête, j'encourage tout le monde à prendre le temps d'apprécier tout ce qu'il y a de bon temps de nos vies, de tendre la main aux autres avec compassion et de vigier l'avenir avec espoir. This is a season to help others in our communities. By taking action to stay healthy and limit the spread of COVID-19, by getting vaccination as quickly as possible, getting vaccinated and getting your booster when you're eligible, by getting tested when required, you are helping to ensure that all New Brunswickers are able to have a safe and healthy holiday season. In New Brunswick, we're able at this time to meet and gather under a level 1 that was modified somewhat, but allows us to meet at Christmas with family and friends. It is through the concerns of what we're seeing around us, what we're seeing in every province, and the sudden growth of Omicron, and knowing that that's at our doorsteps and it's coming soon. But you know what has happened throughout, as there's been this gathering, this super spreader gathering, that is inevitably spread across an entire province and across the entire country and across many countries in the world. We are taking this action after Christmas, but before New Year's for a reason. New Year's can be, and the period between Christmas and New Year's, can be a very significant time for people to gather in large numbers and to celebrate. We want to celebrate. And as someone said, it's better to put off celebrating now so we can celebrate later than celebrate now and grieve later. We've seen actions over holidays create a major concern for us here in the province. We are trying to avoid that. And we're trying to say, look, let's enjoy our family and friends. Let's keep the gatherings as minimal as possible. And let's put in the measures we need to ensure we don't have that super spreader event coming in the new year. We know that even with all these initiatives, it will take your own initiative. It'll take everyone to do their own thing to protect themselves and the ones they love. We can do this, and we can come out of this on the other side, but we can only do it together and as one, the way we've been doing this through COVID throughout. Our hospitalizations are the areas of risk. Our healthcare workers, our frontline workers, people that we need to ensure we have access to, our facilities stay open so that critical care can always be provided in this province. Let's ensure that ability and capability continues. Thank you. Merci.
Thank you, Premier. Thank you, Minister Shephard. Thank you, Dr. Russell. Merci beaucoup, Monsieur Premier Ministre, Ministre Shephard et Dr. Russell. Nous allons maintenant procéder aux questions, aux périodes de questions avec les membres des médias. Vous avez le droit de poser votre question dans la langue officielle de votre choix. Chaque journaliste aura une question. We'll now proceed with questions from members of the media. Each reporter will have one question, and you have the right to pose your question in the official language of your choice. Vicky Hogarth, CHCO TV.
Thank you, Bruce. Premier Higgs, should New Brunswickers who are traveling during the holidays, especially those who will be traveling internationally, expect that more travel restrictions could be coming in the days ahead, especially if there is a big rise in Omicron cases? For instance, are you considering making quarantining for maybe 4 or 5 days mandatory for all those entering the province, even interprovincially, such as PEI and Newfoundland have done.
I would say anything is possible given in the coming days, given what we're seeing and to what level the Omicron virus actually spreads. I think anyone coming into the province at this time should indeed, plan to isolate, test, and take the in terms of internationally, they're doing that now. And after 5 days, taking a test, but testing intermittently. I think that anyone moving and going to other provinces, when I met with my colleagues this past week, when I referenced in the meeting, we talked about, protecting each other through transmission through our provinces. And that means testing, taking the test kits, testing, and making sure you are negative before you go to visit. But where it goes coming forward, for what we're seeing around us, yes, we could be back here regularly, with additional measures as required. But I need to stress, what we're asking for right here is really common sense. And anything short of common sense is going to pose a risk to what we have to do further. I don't believe for a moment that we can have enforcement to cause people to do the right thing. But I do believe that people will do the right thing because we've always been close, and now we're moving fast, quickly on the third dose, so we can get through this and not have a big wave. We're going to see Omicron rise. There's no question about that. But to the degree of it rising will be totally dependent on us.
Thank you, Premier. Andrew Waugh, Brunswick News.
Thanks, Bruce. Premier, there's a couple of things going on there. I mean, you're talking about the exponential rise of Omicron and how dangerous it is, yet you're still allowing Christmas to go ahead. You're saying we're in a race to get boosters out. Why not open up the boosters to, like Ontario did today? Everybody over 18, it's been at least 3 months, just go and get your shot. Do we not have the capacity, or were we not ready for this?
Hi, Andrew. So we do have a plan in terms of getting our boosters to the most vulnerable people first and trying to get the 5 to 11-year-old children with their first and second doses over the next little while. So that is the plan. We will reduce the age as we move forward. We do have to be very cognizant of supply, of capacity, and all of those things. So they're all factored into our rollout of this plan.
Andrew, I was just going to add to that in relation to the boosters. I think what you see is a proactive stance here. We do not have, if you followed our current curve of infections, we've been pretty steady at the 100, 130 average with peaks in the mid 150s. But our hospitalization has been consistent. We haven't seen a large increase in hospitalizations, and that has been helpful, even though certainly hospitals are strained. So we started the booster program 50 plus, and that's certainly, been rolling out and looking at the timing in which that would be accessible. But those are the vulnerable areas. It's important to get to see the age group, the health group, the daycare workers, folks that will be vulnerable in order to keep us moving going forward and that have certainly a risk in this process. So we'd started that, several weeks ago, irregardless of Omicron coming our way. So now the moves we're making today is not because we have this situation right today in our province. It's because we see this situation all around us, and there's no reason to think that it won't eventually get here. Hopefully later, hopefully never, but the odds are pretty high that it will. So we are in fact reacting today much quicker than our current situation might dictate, because our success has always been in moving quickly, and that's where we are.
Both. Alexandre Boudreau avec l'Acadie Nouvelle.
Oui, bonjour. Ma question est pour la Dr. Russell. J'ai vu que, il semble que vous avez changé les mesures de la phase 2 sur votre site web. On parle maintenant que les ménages doivent limiter leurs contacts à une liste de 10 contacts. Avant, on parlait d'une bulle de 2 ménages. Pouvez-vous m'expliquer exactement tout ce qui a changé et pourquoi vous changez ça aujourd'hui alors que vous annoncez qu'on passe immédiatement à la phase 2 lundi?
Oui, alors pour la phase 2, on voulait être aligné avec les autres provinces qui annoncent les mêmes restrictions au niveau des nombres de gens pour la limite. Et les 10 plus votre meuble, votre maison, ça inclut toutes les personnes qui vous avez besoin pour le support des enfants dans d'autres situations familiales. Alors, c'est votre maison plus 10 autres, mais les mêmes 10.
Merci, M. Boudreau. Merci, Dr. Laurel Lyle with CTV.
Thanks, Bruce. This question is for the Premier. Given the number of cases of Omicron that we're already seeing in the province, not to mention the regions around us, why take the risk at all of not putting in restrictions in earlier before people gather, on Christmas Eve, Christmas, Boxing Day, that sort of thing?
I think what we're seeing right now in the discussions we've had is that we had a winter plan that laid out based on what we saw in the province that would trigger the different changes to level 1, level 2, and level 3. What you're seeing here is a modification of that and a moving to level 2 quicker because of what we're seeing around us, not what we're seeing in New Brunswick. And our level of the Omicron virus right now, I believe the case numbers are in the order of 30 or 35. And we haven't seen that doubling of cases. In fact, our cases continue to say, as I said earlier, they're staying in the maybe 110 to 140 range. So we are reacting now based on what we see around us. And as the minister said earlier today, when you get a forecast of the storm coming, you start preparing, and you start battening down the hatches and closing on the windows. And so what we're doing is we're tightening up, while at the same time, the balancing act of all of this is, what will people accept? Would people accept if I was here today without this case count around, in New Brunswick, but seeing it all around us and say, well, we've decided you can't get together with your family after all at Christmas? We went through that at Thanksgiving. So we're trying to balance it with the common sense approach that it's coming. We need to tighten up. We need to minimize our risk. We need to do it make sense, and giving people adequate time to prepare for next week and the New Year's Day, because we just cannot have those celebrations like would likely be planned and which are planned already. Those are the risk areas, and we just cannot jump and do it immediately. But we can warn people, you must make these changes and not participate as one might have hoped through the New Year's period.
Thank you. We're now going to go to Marie Sutherland with CBC. Ms. Sutherland?
Hi, my question is for Dr. Russell. You're asking everyone to, well, I believe it's actually Premier Higgs who mentioned that everyone should be using rapid tests, but we're seeing very long lines and traffic backups at several rapid test pickup sites, lineups around the block in the cold. Is there a shortage of these tests, and is public health considering ways to speed up access to them?
Hi, Marie. So I am aware of some of those long lines. We don't have a shortage. We are really doing our best right now to distribute those. Again, right now we have 189,000 kits or 1.5 million tests on hand. We anticipate another 500,000 tests this week and another 750,000 tests arriving the first week of January. And as of right now, more than 6.4 million tests have been distributed to date through large employer programs, small and medium-sized chamber programs, the outbreaks, and 41 regional health authority community clinics, 15 Vitalité, 4 Horizon Hub, and 22 microsites. Yesterday alone, 25,674 kits were distributed, which equals 218,450 tests at the regional health authority locations. So again, we've got all of these tests available. We are distributing them. We do want people to understand that there are other places to pick them up. Horizon has different holiday hours, though, for the POCT pickup sites. So December 24th, it's 1 to 4 in those hub sites. December 24th, the mobile sites will be open as usual, 10:30 to 2. And then they'll be closed on December 25th, 26th, 27th, and 28th, as well as the January 1st, 2nd, and 3rd. And in Vitalité, all the locations will be closed on December 25th, 26th, and January 1st and 2nd. So obviously, the rapid tests are not designed, they're not intended for individuals who are symptomatic. Those people require a PCR test. So they need to get registered for a PCR test. So especially those people if they've been a close contact of a case. So far we've really seen a really great uptake in the point of care tests. We've seen the people who have tested positive with point of care tests get their PCR confirmatory test. So that is working extremely well. I mean, again, this is not 100%, but it's one more tool in our toolbox. Again, we'd like to lean on all of those different areas because, again, we are facing Omicron upsurge in the coming weeks. And again, we really need to maximize and be as efficient as we can in our approach.
Thank you both. Bobby Terrien avec Info Weekend.
Oui, allô, c'est Acadie Nouvelle en fait, mais c'est correct.
Excuse-moi.
Pas de problème. Ma question, ça serait pour la docteure Russell. On a parlé tantôt de tests qui ont été distribués dans les écoles pour les élèves, en fait, pendant le congé scolaire. Ma question est de quelle façon on compte s'assurer que ces tests-là sont passés là, avant le retour à l'école de la part de ces élèves-là?
Vous voulez savoir s'il y a une façon qu'on peut renforcer le fait que tout le monde a besoin d'utiliser les tests avant le retour à l'année scolaire dans le mois de janvier?
C'est ça, ouais. De quelle façon on va s'assurer que c'était... Parce qu'on demande à certains élèves, je crois, de passer des tests chaque jour là, quand il y a des éclosions. Puis on demande aussi aux autres élèves de les passer à une certaine fréquence. Donc,
oui.
Comment on compte s'assurer que ça va être fait avant le retour à l'école, en fait?
Oui, la seule chose qu'on peut faire, c'est juste communiquer avec le système d'éducation, les parents, les élèves. On peut juste faire notre possible pour assurer que les gens comprennent ce qui est demandé d'eux et ils peuvent faire toutes les choses qu'ils ont besoin de faire et suivre nos avis.
Merci. Pascal Rochnog avec Radio-Canada.
Oui, bonjour. Ma question, c'est pour la docteure Russell. C'est juste une question de précision parce que au cours des derniers mois, on a répété souvent que lorsqu'on parlait de contacts rapprochés, lorsqu'on avait des contacts au restaurant ou dans un lieu qui nécessitait la preuve de vaccination, ça ne comptait pas dans la liste de contacts rapprochés. J'aimerais savoir, avec les règles actuelles et les règles qui vont changer là, le 27 décembre, lorsqu'on voit une personne dans un restaurant où la preuve de vaccination est exigée, est-ce qu'on doit ajouter cette personne-là à notre liste de contacts rapprochés? Est-ce que ça compte dans notre bulle de 20 ou notre bulle de 10?
Bien, si vous êtes dans un restaurant, puis vous êtes moins de 2 mètres avec quelqu'un, puis vous ne portez pas vos masques, vous devrez compter cette personne-là comme un contact étroit quand le traçage de contact étroit est fait.
Merci. We'll now proceed to Travis Fortnum with Global TV.
Hi there. My question is for Dr. Russell. So we're hearing about the dire situations outside our borders. Wondering what you would attribute this. So we're not seeing that in New Brunswick. Wondering what you would attribute that to.
I think it's being delayed here. We haven't had a super spreader event. Other jurisdictions have had super spreader events. That doesn't mean to say that we can't have that situation happen here at any time. There's so many different analogies we can use at this time. the cases will go up. I mean, I think we just sequenced another 40. I know we had 30 the other day, and I just received information that I think we have another 40 cases of Omicron. So, you know, again, we expect that number to double every 2 to 3 days. So if you do the math, even with all of our efforts, we will see those numbers go up. But we really need the cooperation of the public right now to understand the severity and, again, delay that rise in cases as much as we possibly can. And the only way to do that is to limit our close contacts.
Thank you. Erica Butler with CHMA, Sackville.
Hi there. Yeah, many thanks. I guess I'm curious. I'm just sort of following on the last question here. This level going to level 2 on December 27th is. I gather the argument there is that we're acting preemptively on Omicron, but Omicron's already here in New Brunswick. So I guess I'm wondering about the status of those cases. The ones that we found, are they contained in any way, or is Omicron currently circulating right now in New Brunswick? And how susceptible are we to something like what's happening in Nova Scotia right now?
Well, again, we haven't had a super spreader event with Omicron. My understanding of the cases, because I asked my team today if any of them had been hospitalized yet, there have been no cases of COVID-19 with the Omicron variant that have been hospitalized yet in the province. I do expect to see hospitalizations of Omicron cases soon. Again, it's just difficult to predict the timing. So again, as we see those numbers rise, we eventually will see the cases of hospitalizations of Omicron, of the Omicron variant going up as well. Again, we're in a little bit of a holding pattern in terms of the stability right now, but I wouldn't expect that to remain what it is right now. So again, we're trying to do everything we can to manage what the current situation is and try to look ahead at what we can do to prevent a surge from happening.
Thank you.
Just to confirm, Dr. Russell, does that mean Omicron is currently circulating?
Well, as I mentioned, we had identified 30 cases the other day, and I just received information that we have another 40 identified. So I anticipate that number is going to continue to grow. So we do have cases of Omicron. Can I say that 100% of the contacts have been traced and isolated? Again, we try to do that within 24 to 48 hours. Is it done 100% of the time? Probably not. That's why we're having to adjust how we do our contact tracing and case management, as other provinces are having to do as well.
Thank you, Ms. Butler. We're going to go to Greg Mercer with the Globe and Mail.
Thanks, Bruce. This is a question for Dr. Russell. Is the province changing its isolation advice for healthcare workers? In other words, do you anticipate any kind of move towards a test to stay approach to avoid some of the staffing shortfalls that you've been describing?
Yeah, all the jurisdictions are having those same conversations. Certainly, we are having that conversation right now. So whatever we can do to maximize our healthcare worker staff to avoid shortages, we will do within reason, obviously, but that is part of the conversation.
Thank you, Mr. Mercer. We're going to go to Sarah Seeley with Brunswick News.
My question is for Dr. Russell. I was just wondering if the province was considering making N95 masks more accessible to people, given the recommendations from Dr. Tam and the Public Health Agency of Canada.
Yeah, so Dr. Tam's messaging we definitely support. Her most recent messaging is around getting the best, tightest fitting mask that you can. Obviously, a surgical mask is better than a fabric mask, and within the surgical mask, obviously KN95 is better than a surgical mask in terms of that protection. But again, it's about levels of protection and what you have access to. So at this time, again, we support the recommendations from Public Health Agency of Canada around getting the best fitting mask possible.
Thank you, Sarah. Sarah Macagnon avec CHAU TVA. We'll now go to Carissa Donkin with CBC.
Thanks, Bruce. My question is for Dr. Russell. New Brunswick had 38 accidental opioid overdose deaths last year. I believe that would be the highest toll in our province going back to at least 2005, which is as far back as I have data. And I know you've worked on some modeling as co-chair of the Federal Special Advisory Committee on the epidemic of opioid overdoses, which was released last week. I'm just wondering if you could talk a little bit about what role the COVID pandemic has played and that you project it will continue to play since we're going to be in this pandemic for the foreseeable future on those opioid numbers here in New Brunswick specifically.
Hi, Carissa. As soon as I heard your name, I immediately thought of opioids because I know we've had many conversations about that situation over the years. There is no question that during COVID, during the pandemic, that mental health and addictions issues and substance use disorders have definitely increased in terms of number of people being affected and the severity of the types of symptoms that they see. So within the mental health and addictions services, obviously that is part of the response of what has been done during the pandemic. With respect to my role as co-chair for that committee, again, it's not a surprise, but certainly it is taken into account in terms of, again, knowing that COVID exacerbates many of these types of issues. This is just one of all of those issues, but a very important one. When I have conversations with Dr. Tam around, what this means at the national level, what this means at the jurisdictional level. Again, I think at this point in time, our work here in New Brunswick with mental health and addictions has been to be able to be responsive as much as possible in terms of providing services. Will this continue to get worse? I think that can happen based on what is happening with the pandemic. Certainly in British Columbia, that has been the trend. Compared to the rest of the country, in terms of the provinces that have had more severe issues with opioids, we just never experienced it on the same level for many reasons, and I'm grateful for that. But it's not to say that, again, we have mental health and addiction supports and services, and we will continue to offer those.
Thank you. Sarah McCagnon. Isabelle Legier with CBC. Isabelle Legier? Before we conclude, Dr. Russell would like to expand on the contact tracing.
Yes, my understanding is there's lots of questions about what is happening now with contact tracing and isolation procedures. So basically, as of today, province-wide, our contact tracers will no longer be notifying close contacts of confirmed COVID-19 cases. So the people who are infected, it's their responsibility to notify their close contacts. Public Health will provide advice to infected persons on what to tell their personal close contacts regarding testing and isolation procedures. Those close contacts are expected to follow the testing and isolation procedures provided by Public Health. Public Health contact tracers will only contact the individual who tested positive or alert their employer that an employee has tested positive. And to be clear, we have not removed the testing or isolation requirements for close contacts. So that will continue. We're just changing our approach in terms of how it is operationalized. So again, Public Health will provide them with them and their household members with isolation and testing guidance, as well as instructions on how to notify the non-household close contacts using template letters. And Public Health will only step in for contact notifications if no other means are available. And we will take specific actions to limit the spread of cases in schools. And just on a separate anecdotal note, We are seeing, again, with the 30% increase in transmission with the Omicron variant, we do have some cases that have successfully isolated in their own household right now with very, very strict adherence to our guidance around staying in a separate bedroom with their own bathroom. If they leave the bedroom for any reason to even go outside, they wear the mask from that point to outside. Somebody brings them food, they either use paper plates and put them in the garbage and just leave it there until their isolation is done, or they leave the dishes in there and the person can rinse them, but they don't come back out. So we have had people who did not end up infecting their household members because they really adhered very strictly to those isolation guidance directions. So we do encourage people to follow it as closely as they possibly can to avoid infecting their household members.
Thank you all. Thank you, Premier. Thank you, Minister. Thank you, Dr. Russell. That concludes today's update. Merci beaucoup tout le monde. Voilà la fin de notre mise à jour. Merci.